Namaskaram. Shri Jagat Prakash Nadda Ji, Honorable Minister for Health and Family Welfare, respected Swami Gautamananda Ji, Swami Vimuktananda Ji, Shri Tarun Vijay, Mr. Chandrasekhar and Dr. Sukumar, respected Dr. Katoch, Mrs. Katoch and many other dignitaries and my leprosy affected friends, brothers and sisters. I think it is, first of all, I should pay tribute to the Ramakrishna Mutt for having arranged this type of awareness workshop. It is really the need of the hour, Swamiji, and you have brought everybody together. I think, and the fact that our minister has come all the way from Delhi to attend this function shows the government's commitment to completely eliminate leprosy from India in the next few years. As previous speakers have said, and you have discussed the whole day today, that India bears a huge burden of the world's leprosy cases. More than 60% of the cases are in India. There are some districts, about 40 to 50 districts with a concentrated number of cases which have a much higher case detection than other districts. So we can focus on those areas. 10% are affecting children, that means transmission is going on. And still we have a large number of cases coming with disability, where they have already developed nerve damage, which is sometimes then after that is irreversible, which means that we did not detect those cases early enough. So this is the challenge, and even though in 2005 India declared elimination of leprosy at the national level, we now want to go one step ahead and achieve true elimination at the sub-district and the district level. It is not only a question of achieving that number, the target less than 1 per 10,000, but truly we need to come to the stage where there is no new case of leprosy in our country. But there are many scientific challenges. And as Swami Vimuktananda Ji was saying, one of them is a vaccine. Any disease where we have a vaccine available, it's relatively easy to protect the population. The government, of course, has to invest in the vaccination program, but at least you know that the future generations are protected. But both for tuberculosis and leprosy, we do not have really a vaccine which is 100% or close to 100%. But we do have vaccines now which are close to 65% or 70% effective. So that is still something good enough which we can utilize. We are planning to launch in a few districts, along with the Ministry of Health, a program to vaccinate the contacts of leprosy patients, the household contacts and the social contacts, to see whether we can reduce transmission. The work on this area, sir, was done in Jalma, and both Dr. Katoch and Mrs. Katoch, very pioneers in this area, they are both here today. They showed that in Ghatampur area of eastern UP in Kanpur district, that by vaccinating the contacts of cases, you could actually reduce the transmission by about 60% in 3 years. They also showed that vaccinating the patients who have leprosy lesions can hasten the healing of the lesion. So both in people with leprosy as well as in the contacts, this vaccine has potential. This is a vaccine developed completely in India by Dr. Pran Talwar. It used to be called Mycobacterium W. It's now called the Mycobacterium indicus pranae after Dr. Talwar. And if it is found to be successful, India will be the first country to use vaccine for leprosy and use a vaccine that is completely made and tested in India. So we are looking forward to this program. The other major challenge is the diagnosis. And now that we do not have a vertical leprosy control or a leprosy elimination program, the general health services needs to really perform that role of early case detection and linking up the patients with treatment. So here also ICMR is working with the Ministry of Health in developing a software program which will track every suspected case and every case diagnosed with leprosy till the patient is cured. We'll be able to see what is happening at the village level, district level, as well as at the national level, so that the health secretary or health minister could have a look at the statistics on a daily basis. It will be updated. So this will give the program a good feel of what is happening on the ground. And the program is also starting the case detection house to house, just like a pulse polio. to go periodically once a year and do house-to-house screening of cases and link them up with treatment. So hopefully with this type of a mission mode, it should be possible to really bring down the cases. But more research is needed, and ICMR has always kept leprosy on a very high priority. Even after it was declared as being eliminated, the work on leprosy diagnostics continued. We are working on a blood test which can be done, because one of the problems again is to find out when the patient has completed treatment. Are they fully cured? Are they still live bacteria? When can we stop treatment? 6 months, 12 months? I was talking to many of our leprosy affected brothers and sisters, and they were telling me some of them were treated in the 70s and they were used to take 5 years of dapsone therapy in those days. Then it came to 2 years. Now we are down to 12 months. And another study done by ICMR has shown that 6 months of universal multi-drug therapy for both paucibacillary and multibacillary cases, this could be effective. So there are research findings which can now be utilized by the program to see whether we can actually speed up the control of leprosy and going towards the elimination. The Prime Minister himself has talked about leprosy and how important it is. And lastly, we cannot of course forget the social and psychological aspects, which is what I think places like Ramakrishna Mutt offer, which many of us working in government hospitals are not able to offer. We can offer diagnosis and treatment, but that healing touch and the rehabilitation, helping the recovery process, the psychological therapy, the counseling, giving them the confidence to stand on their own feet and feel like useful members of the community, that is something that Ramakrishna Mutt and other NGOs are able to do much better. And luckily for us in India, we have a number of NGOs who work in leprosy, who have worked, many of them are faith-based organizations. And through, I think we can utilize our brothers and sisters also to spread the word about why leprosy should not be stigmatized, why people should not be afraid of leprosy, and what they can do, what school children and college children can do really to dispel the stigma. I think only until we attack the stigma can we hope that people will come forward for leprosy testing. That fear has to go. And I think that if we all work together and take a pledge, I think it can be done. So thank you very much again for this opportunity, and all best wishes